Welcome to this episode of Youth Diary. Today we have with us Dr. Rajesh V, who is Chief Pulmonologist of Rajagiri Hospital, Aluva. Welcome to the show, sir.
Hello.
I think smoking and use of tobacco products is a widespread problem in Kerala. So, Doctor, you wanted to say something about this?
Yes, as you correctly said, the usage of smoking as well as other tobacco products is on the increase on many states of India, including Kerala, and more widespread in the youth subjects. There are multiple reasons for that. The first one being that many of the youth are actually not aware that these problems, the problem consequences related to smoking will happen to them. And secondly, it has a lot of addictive substances that even if they want to give up the habit of smoking, they are not able to do that. So these are the two probable reasons that many of these subjects are not able to come out of the habit of smoking.
These days, again, smoking is a very common habit, So how can we help someone give up that habit of smoking?
It's not very easy to give up the habit of smoking. First of all, the smoker has to be extremely motivated to give up the habit of smoking. And in such a case, as a doctor, we can do some assistance to give up the habit of smoking. We basically can do a couple of things. We can give some drug assistance which will help the patient to give up the habit of smoking, as well as we can give some counseling assistance by which the patient can actually be motivated about the harmful effects of the substances in tobacco smoke, as well as some tips to give up the habit of smoking. When it comes to drugs that can help the patient to quit smoking, a couple of things worth mentioning are nicotine replacement therapy in the form of nicotine chewing gums or nicotine patches, and a new drug that's available in the so-called varenicline, it's called in medical literature, which actually makes the patient less crave for tobacco and smoke products if he actually stops smoking.
So I've even seen few drugs like, in the form of chewing gum. So does that really help?
I won't say it helps wonderfully, but it does play its own role in giving up the habit of smoking, in the sense it brings down the craving, it decreases the chance that patient actually goes back to smoking if he actually gives up the habit.
And if a person is a heavy smoker or probably takes a lot of cigarettes in a day, and it is said that all of a sudden the person is not supposed to quit smoking.
I won't really agree with that, because abrupt stoppage is associated with more success than gradual stoppage. So it's always better that abruptly stop it, but if the person is a very heavy smoker, supplement it even prior to stoppage of smoking by nicotine replacement therapy.
Obesity is a result of everything these days. Stress leads to obesity, or probably bad eating habits leads to obesity. So what are the harmful effects of obesity?
As you correctly said, obesity nowadays is multifactorial as a result of genetic habits, the life stress, eating habits, and all such stuff. Now, if you ask me the consequences of obesity, it virtually can affect any organ system in the body, right from the heart to lungs to brain to kidney. You name the organ, obesity can affect it. I will probably restrict myself to lung because that's the area where I am tuned to. In the lung, it can definitely cause worsening of asthma, and more pronounced will be the so-called obstructive sleep apnea, which means there will be fat deposition in the airways as well as in the lung. This becomes more pronounced during sleeping, where the patient can actually go ahead with snoring, and when the snoring becomes very severe, it leads to blockage of respiration during sleep. This is known as the obesity hypoventilation syndrome, and when that becomes severe, the patient can have repeated stoppage of breathing in the night, with resulting in decreased oxygen levels, increased carbon dioxide levels, and can even translate to heart attacks, death during sleep, and even brain strokes.
So we have queries coming from QSAT. So the first query is:
Hi, myself Gene, I am from QSAT. I just want to ask that tobacco products are always harmful while they smoke. So why are the people still succumb to these use?
Yes, as I told previously, smoking is a very difficult habit to give up, primarily because the products in the tobacco are very addicting. It becomes very difficult for the person to give up the habit even if he feels so. There are bigger dimensions to that, in the sense we need to have more public health initiatives that will help the person to give up the habit of smoking. Now, legislation is one wonderful form of public health activity, but there needs to be increased focus on increasing the tax on tobacco and maybe active programs that will help the person to give up the habit of smoking and such stuff. And I said previously, there are some medical helps that we can offer in the form of nicotine replacement gums and some of the drugs if the person is really motivated to give up the habit of smoking.
So let's move on to the next query.
Hi doctor, I'm Kiran from CUSAT. Is asthma common in the youth?
Yeah, asthma is definitely a disease of the youth. Asthma is a disease that is on the increase. As we all know, asthma is an allergic manifestation that involves the airways and the lung. So anyone who is allergic has a tendency to become asthmatic or VC as he grows on. The majority of cases of asthma occur in childhood. The onset is less than 10 years of age. But then a substantial proportion of these children actually grow out of asthma, in the sense they become less allergic as they grow up, so that by the time they reach puberty, they become no longer allergic or no longer asthmatic, and they actually give up the habit of, or rather stop having frequent wheezing. A small proportion, around 20 to 30%, can actually remain allergic or asthmatic that can persist into adult life. So cutting a long story short, definitely asthma is on the rise in youth, and asthma is by and large a disease of younger children and adults, but it can persist into adult life also, the so-called adult onset or adult persisting asthma.
I think it's also because of the pollution that is there.
I can't agree more with you, in the sense anyone who is allergic, there are atmospheric triggers which actually worsens the symptoms, and when the atmosphere is quite bad in the form of dust, smoke, fungus, or the atmospheric and automobile exhaust, these are the stuff that can really worsen the asthma control and really drive the patient into a sort of wheezing and respiratory difficulty, to the extent that he can even go into respiratory failure with potential threat to the life. So atmospheric alterations are mandatory for controlling the allergic symptoms and asthma.
So let's move on to the next query.
Hi doctor, I'm Piyush, I'm from CUSAT. Is lung cancer a disease of old age?
Yes, lung cancer is another respiratory disease that is really on the increase. As I said, smoking is rampant, and smoking is one of the major risk factors for the development of lung cancer. Now, non-smokers can also develop lung cancer. There are factors other than tobacco smoke that can cause lung cancer, but by and large that is a minority. Now, coming back to the question whether lung cancer is a disease of old age, I won't necessarily say it's a disease of old age, but it's less common or extremely unlikely in children and adolescents. So the majority of lung cancer in India occurs after the age of 35 to 40 years. Even ladies become affected. Lung cancer can manifest in a multiple ways, like it can just present with worsening of cough or shortness of breath. It can present with spitting of blood. It can just present with loss of appetite, loss of weight, and general wasting. It can even present with manifestations outside the lungs, like somebody can have distension of the abdomen or bone pains or even fits and brain manifestations. The problem with lung cancer is that it manifests quite late. It has a long period when it slowly grows but doesn't really give you any clue to the existence. So the motive of the day is to actively find out whether someone has lung cancer. In such ways, screening programs for lung cancer can do some help for early detection, and that way better survival of lung cancer patients.
So how much do you think is the survival of a person during the second stage or almost a critical stage?
By and large, we medically divide lung cancer into 4 stages, 1, 2, 3, 4, that way. Anyone who is diagnosed at stage 1 or maybe early part of stage 2 is amenable to excellent treatment. I would say that these people have a decent chance of surviving 5 years or more if the whole cancer is removed by a surgical procedure. Now, anything in stage 3 or beyond, the survival is not as rosy as in stage 1 or stage 2. The sad fact remains that a majority of patients who have lung cancer actually present to us in stage 3 and 4 when the survival is not that good. That is why I said the emphasis should be on early detection of lung cancer Of course, there is a major role for prevention of lung cancer by avoiding the harmful effects of smoking and such stuff. But once that's done, early detection should be given due focus in the way of maybe mass screening programs or things like that.
So the next question will be, what is COPD? That is chronic obstructive pulmonary disease. Can younger generation be affected?
Yes, chronic obstructive pulmonary disease, put in simplistic terms, is the prototype of smoking induced lung disease. Here what happens is the effects of smoke and the various constituents of tobacco smoke leads to progressive decrease in the lung volumes and capacities. So lungs fail to function as an organ for the so-called gas exchange, where the primary function of the lungs is to take in oxygen from the atmosphere into the blood and to take carbon dioxide formed in the body back to the atmosphere. So when lung capacities come down, the lung is able to perform much less efficiently. This gas exchange process becomes much less efficient, as a result of which there occurs decreased oxygen content of the body and elevated carbon dioxide content of the body. So ultimately it becomes the so-called respiratory failure, where the lungs totally fail to perform its function. In the late stages of COPD, what happens is even the heart, especially the right side of heart, can become affected. The pumping of the right side of the heart gets affected. So that becomes a dual lung plus heart failure in severe forms of COPD. Coming to the second part of the question, whether it can affect younger generation, again this is usually a disease which manifests in later adulthood, maybe after the age of 40 or such stuff. Again, there are abnormalities in a person which will make him susceptible to COPD at a very young age, but by and large it is a disease of the middle-aged or elderly.
Yeah, having spoken about COPD, I wanted to understand how early it can be detected and how it could be done.
Yeah, just as in the case of lung cancer, COPD is also a disease with a very large latent period, I would say. That means the person or the patient has to wait a lot before he starts getting the symptom of the disease. So again, this is a disease where early detection has some role. Our routine examination by a doctor even might fail to detect COPD in the early stages. So probably you will have to go ahead with sophisticated investigations which will help us to detect the disease early. In this regard, the so-called lung capacity testing, or we call it spirometry or pulmonary function testing in medical language, this is one of those tests which will help to detect COPD quite early. This will identify which smokers are actually severely affected by the lung disease, and it will even give a clue, or it will help us to advise many of those smokers that they are getting severely affected with their lungs, so please give up the habit of smoking. Again, it will help us to identify the severity of COPD and accordingly formulate treatment for COPD. So cutting a long story short, spirometry or pulmonary function testing is the test which will help us to detect COPD at an early stages and decide treatment.
So doctor, I wanted to understand, like, how much is it in the reach of a common man? Are these tests very expensive?
Not really. I think when it comes to pulmonary function testing, your question is totally out of place, because pulmonary function testing right now is available in most of the tertiary and maybe even some of the secondary care hospitals of our state. And the test is quite cheap in the sense it hardly costs you around 500 to 600 rupees, which will help you to detect the disease early. So I think it's not beyond the reach of a common man, whether it is economically or whether it is accessibility.
It's just about the awareness and
Exactly.
and motivation to understand
Exactly.
early.
And the fact that the community has to realize that this is the test that will clinch the diagnosis at an early stage.
So talking about all dangerous diseases, I think pneumonia is one which cannot be ruled out, always. So how dangerous is actually pneumonia, and if you can tell us something about it?
Yeah, pneumonia is one of the most dangerous diseases of the respiratory system, I would say. Pneumonia literally means infection of the lungs with organisms, that is microorganisms. Most commonly bacteria, but it can be virus, it can be fungus, it can be other microorganisms, but by and large it is infection of the lungs by harmful bugs. It is definitely dangerous in the sense it doesn't really give us time to detect and treat if that crunchy small period of time at the initial part of the disease is circumvented. That means The patient presents with symptoms like fever, cough, sometimes shortness of breath, all those stuff, and the real window of opportunity will be around 2 to 3 days, where you detect that this could be a pneumonia. The problem even with a doctor is that many of the simple respiratory infections like throat infections, tonsillitis, pharyngitis, bronchitis, all this stuff present with similar symptoms, and it becomes a challenge to detect pneumonia or differentiate pneumonia from these conditions which are not actually that dangerous. A good physical examination can help us to detect pneumonia, but more frequently we might have to go ahead with the chest X-ray examination to detect pneumonia. Once you detect that, the patient has to be on antibiotics, maybe slightly stronger antibiotics than what we usually give for simple respiratory infections. If the pneumonia is severe, he might have to be hospitalized. If that window of opportunity of around 2 to 3 days is missed, the infection can actually spread to other organs. It can result in multi-organ failure, it can result in respiratory failure and even death. So that way, pneumonia detected early is a simple disease to treat and cure, whereas that window of opportunity gone means the patient can even proceed to death.
One side we can see that the automobile industry is booming, and the other side we can see that the ill effects of it is like increase in the percentage of atmospheric pollution. So I would like to ask doctor, how does the atmospheric pollution really affect the health?
I won't comment on the automobile industry per se, but then I will probably focus on respiratory health and the ill effects of atmospheric pollution on respiratory health. Now, if you take away smoking and the effects of smoking, the second best villain for respiratory disease will be the atmospheric pollution. Something that is preventable, but then how practically that's possible, I am not very sure. Again, we do need legislations, we do need commitments at a larger level, but atmospheric pollutants are as harmful to the respiratory system as tobacco products. They can cause the same effects, they can cause asthma, they can result in worsening of allergy, they can cause shrinkage of the lung just similar to the tobacco products, and many of those atmospheric pollutants can actually cause cancer also. So by and large, almost all ill effects that's possible system can be induced by atmospheric pollutants. At a personal level, what all can we do to avoid the ill effects of atmospheric pollutants? I said at a larger level we can do legislations and awareness and all such stuff. At a personal level, you have respirators and masks which do help to some extent in circumventing the effect of harmful atmospheric pollutants. But again, the availability, the discomfort of using all this stuff preclude their regular usage. If someone is at a very high atmospheric pollution area, like somebody who is working in mines, then we do have personal detection equipments where you really have measures of how much pollutants the person is susceptible or person is exposed to. When that goes beyond a limit, probably he should be taken away from that occupation. That's one way of looking at things. And secondly, if somebody is at high risk occupation, say traffic police, it may be worthwhile to do periodic respiratory examination of such people, like maybe a chest X-ray at 2 yearly intervals. Spirometry, I said, you can measure the lung capacities, maybe do that yearly. If that's significantly falling, probably take them out of that particular profession. So that way, early detection and prevention will be the key.
I totally understand that and agree with doctor. See, the main thing is that it's every second that we take breath, so it is a very important part of our body, and I think it was really wonderful to have Dr. Rajesh here, and it's almost time for us to wind up this episode. And in the meanwhile, when you have any queries, please mail us at youthdiary@rosebowl@gmail.com. Till then, see you next week. Bye bye.